Okay, so hello everyone, and thank you for coming. Hello Keith, nice to see you after such a long time again. So today is lecture 44 conducted by Dr. Zenke. Topic of this lecture is EHF EMR in daily life. It's meant for the non-medical application. And in this lecture we'll talk about preventing stress, cosmetology, water treatment, and sports. So that was my short introduction. And now we can start with this lecture.
Yes, we now finishing the medical methods and medical possibilities which we can use with this AKTOM. This is high frequency electromagnetic radiation. We heard about the broad field of possibilities to use this device in different medical applications, and especially in physiotherapy. Now I want to show you some examples how to use this device in daily life in non-medical applications. As we heard before, the main development was driven by Russian scientists, which found out that there's a broad influence of low-intensity electromagnetic radiation to biological objects, and among them to human beings. This is a very intense, or in this field, a very intense research is going on. And in future, I think we will find or heard about a lot of practical applications of this method in different fields of biological application. At first, the field of prevention. In prevention, the most effective way is to follow the rules and the strategy of acupuncture. And for prevention, we have 5 magic points I'll show you. The program 1 is activating these meridian points, and the program 2 is decreasing the energy of the meridian or calm down the meridian points. And so you can, depending on your personal situation, work with these 5 points according to your feeling, to your personal behavior. We have heard already about some of these points, but I try to repeat the full picture of these preventive applications of EHF radiation. The first very important point is the CV17. It's 6th sun below the suprasternal notch. For men, in general rule is it's the level of breast nipples. This point has a very important role influencing the immune system, because it's a central point of the sternum, and inside the sternum we have an active production zone producing blood cells, which can be influenced by this point. Here we use the program 1 in using the yellow oscillator, or if you have it, you can use the red oscillator too. The result is activating the immune system, activating the metabolism, strengthens the lung and the bronchial system. To use this point, you must have in mind that the first point, activating the immune system, you can use it in every case of medical treatment if you have processes which needs in activation of the immune system. Let's say inflammation or better healing of surgery wounds. This point helps you to activate the immune system and the metabolism. But you must have in mind it's not possible or not helpful activate the immune system in every case. For instance, if you have autoimmune diseases, or if you have allergies, it's dangerous to activate the immune system, and you must be careful using this point in case of these diseases. The second important or magic point is the point of the governing vessels 14, Ta Chui. This point is below the protection between the 7 cervical vertebrae and the first thoracic vertebra. You can feel this point, it's a little bit higher than the surroundings. It's such an hard bone you can feel in the spine. This point corresponds to the center of the sternum, that activating the immune system too, and activating the breath system. That's why it's a good point for the prevention of cold and for strengthening the lung and the bronchial system. So in the time of autumn or winter, bad weather, you can use this point for prevention of cold or of bronchial diseases. It's a favorite point of Dr. Istomina, the ST6, it's a stomach, 36, it's a stomach meridian, and the point is 3 sun below the lower edge of the patella and 1 sun on the outer side of the shin bone crest. This point is very helpful in case of the necessity of general activation of the processes. It's helpful to improve the energy flow, and it's helpful to activate the psychological or helpful in emotional and psychological down. That's why this point is used in many therapies in combination with other points to support the specific therapy and give in general activating influence and general and emotional increase of mood, so if you so want. This point you can use at both legs, at both sides, so it helps you in prevention of the winter depression. It helps you in exhausting circumstances to improve the emotions, the psychological feelings, and the energy flow. And in every case, you can support a medical treatment using these points, not only in prevention, but in supporting medical treatments. And famous point 2 is the EGU, the large intestine meridian, point 4. It's in the middle of the hollow between thumb and index finger. You can feel this point. If you press it, it's a little bit pain. It's a remarkable pain. The same is with the point before. You can feel this point too, because it gives you the impression of a little pain too. And the second important, on the hand, important point is the MC6, NEG1. Both points are very helpful. I'm using them very much because they give the general activation of recovery mechanisms, and they are strongly influences the autonomous nervous systems. The nervous vagus system is activated, and that's why it's lowering the physiological stress. It is an advice to start every medical procedure with this treatment, because normally the patient, the client, has a stressful situation and stressful feeling in the therapy surroundings, and using these 2 points you can in general decrease this physiological stress and increase the vagal system, or parasympathetic system. It's another name for the same nervous system. These both points, if you want to activate them, you must follow the rules. Using program 1, you must follow the rules of medical therapy. That means less than 30 minutes per day, and 1 cure cycle is 10 to 12 days. The results of this is to increasing the activity of the parasympathicus and the increase of the metabolic activity in recovery and constructing tissues or in recovery organ. In some cases, you have the so-called vagotonic reality. That means that the vagus is so active that the people are very weak, very exhausted. Then you can start with program 1, but not in the first therapy or first recovery cycles. You can run in the program 1, but not the full time. You can start with 3 minutes, then 5 minutes, 8 minutes, and only after 3 or 4 sessions you can start with a full time of 10 minutes. It's a good recovery cure cycle, for instance, in spring, to activate the metabolism and to activate the health processes inside after the winter time. If you want to lower the energy of this autonomous nervous system and decrease the energy of the sympathetic part, you must use the energy lowering program 2 to the same points, and so you can decrease your sympathetic activation, which is important for, let's say, stressful working situations or stressful impressions from the surroundings. Both these processes are widely used in sports. We are cooperating with the skiing team of the Komi Republic in Syktyvkar. They are training long distance skiing and biathlon, and both teams are using the Akatom device to prepare competitions. In recovery, they are using the program 1, and in for these teams, they have nearly every week they have a competition, and for them it's very, very important to recover after the competition to be prepared for the next, and that's why it's very good for them to use the Akatom and using the points named before to activate the metabolism and to calm down the autonomous nervous system. All these preventive measures you can use in the like in cure or like in treatment at home, but as I said before, using program 1 you must follow the rules. Using program 2 you can use it without any limitations. These 5 points experienced therapists are using in combination with other therapies too. So it's not only a preventional method, but only a therapy supporting method, because improvement of energy of the body, improvement of metabolism, improvement of immune systems helps in many kinds of therapy. Even these points are used to support the oncological therapy, the cancer therapy, because it can help to have lower side effects of the radiation therapy or chemical therapy. These are the main features you can use in preventional methods using Akatom. In another method for home use is to use the Akatom activator. Here we are speaking about the activity of water and solutions of biological active substances. As we heard before, one of the physiological mechanisms to how we can explain the treatment with EHF radiation is the interaction with dipoles of water molecules in the solvatation shell of the biomolecules. In results, we have changes in functionality and in biological activity. And research in different kinds of water and water solutions was found out that the treatment of water and the treatment of solutions gives an activating volume of this water or solution, and so can, if you bring it to biological objects, if, for instance, if a human being is drinking such kind of water, it's have biological effects. How we can discuss this? Activating water or biological active water is under scientific discussions. There are some scientists who reject the existence of activated water at all, but a broad experience of different laboratories shows that the structure of water can be changed by EHF radiation, and this changed structure of water, which we call activated, is able to influence biological processes. We have here 3 examples. We have the activated water for health protection of people, pets, and plants. We have the protection of crop with minimal use of pesticides, and we have increased growth of crops. The uniqueness of this background resonance therapy gives the possibility to activate the water and to support the biochemistry of living processes. How we can imagine this? We have the structure of a water molecule consisting of 2 hydrogen and 1 oxygen. And this molecule is non-symmetric. We have no symmetry axis reaching both hydrogen atoms, and that's why we have a dipole moment in the molecule, and so the water molecules can develop so-called hydrogen bonds. They can exchange electrons and be connected via this hydrogen bonds. It's very good shown that these hydrogen bonds and the energy of hydrogen bonds very much influence the characteristics of water and how water can influence or can take part in different chemical processes. In the last last 5 years, a lot of research was done about the so-called water clusters. Brooks Pate of the University of Virginia has developed the theory that all water clusters are based on 3 different structural elements which are not, or which cannot be transmitted or transformed one to another. So they, like a puzzle, they connect the whole structure in the water volume. They have a prismatic construction, a so-called cage, and a book, which can be open and closed. How to do it practically? We can use a normal bottle of mineral water. Put on this bottle the cup given with the Akatom activator. Put it bottom down or bottom up, and then connect the activator and let it influence the water. So we can influence with these activators volumes up to 3 liters in a bottle. If we want to influence bigger volumes, then this small activator gives not enough energy, and we must use other technical constructions. But for the domestic use, for home use, it's enough to have the possibility to influence a volume of 3 liters. If you want to influence other kinds of vessels or other kinds, you can use it in a different way. You can put the oscillator given with the activator in a polyethylene or polypropylene foil and put it inside or on the top of the water volume. You must have in mind that the connection between the cable and the oscillator is open, so you must prevent this connection point from water. If the water comes inside the oscillator, it's destroyed. This activated. Huh?
Can I ask a question?
Please ask.
What do you use it on program 1 or program 2?
No, it's the activator is a special device which is used only for preparation of water or water solutions, and it's different from the EHF with these different programs. Here you have programs only depending on the volume of the water. So it's if you want to use this, you must have this EHF activator. Many of my friends and colleagues are using this water not only for drinking, but they use it at home to give it to their plants, and they are very impressed that it's given good support in growing the plants at home. And you can use it, of course, for your animals, for your domestic animals, which gives them a health support too. But we cannot only treat poor water, but we can treat biocide solutions. These biocide solutions can activate it, and so you can decrease the concentration of the biocides from 2 to 4 times with simultaneous increase of its activity from 100 to 400%. It depends on the type of biocide. Here you have some examples: growth, suppression of mold, fungi, and the fungicide used. It was given non-activated or untreated to the picture 1, and after treatment of the fungicide with EHF activator was compared in the picture 2, and you show that the influence is much higher. This work was done for different biocides by Dmitry Kverzhev at the University of Nizhny Novgorod, and he showed very good results to decrease the amount of used biocide. You have the same, the antiseptic azan is used to penicillium. The activity is again after treatment increased, and so you can, with the same activity, with the same amount of fungicides, reach better results in disinfection and in fungicide and in fungi destroyment. Here you see for different disinfectants used in Russia or available in Russia, the research was again realized by Mr. Kuyashev, and he showed that you can, for different disinfectants, realize an increase from 115%, there is an increase of 15%, up to an increase of several 100%. Here was controlled for different fungi the so-called colony-forming units. It's the points you saw in this Petri vessel. You can compare it with direct influence of this BRR treatment. Then you have the increasing activity of this fungicides you see here in the picture. It's not only working with fungi, but it's working with bacillus too. You see again a change in the so-called colony-forming units. Here you have a microscopy of the bacteria Staphylococcus aureus. Staphylococcus aureus is a very, very important bacteria in the hospital surroundings because it causes very strong and very horrible inflammations in surgery wounds, up to necrotic destroyments of the tissue and up to the necessity to take all this tissue away by surgery. Here you see that treatment of this Staphylococcus aureus with EHF radiation shows the destroyment of the bacteria, and the result is a much, much lower amount of bacteria in the cultural medium. You see the time schedule. That means here was a treatment of about 1 hour and nearly no bacteria are remaining. Here are given the results in figures, different fungicidi of Teflex agent.
Can I ask another question?
Yeah.
So the Staphylococcus, the treatment of that, how was that done?
I couldn't understand you. It's a very bad audio connection.
The Staphylococcus treatment, was it done with the activator?
No, yeah, it was done with the activator.
Okay.
Here we see some Ascomycetes. It's again fungi which can be also destroyed with the BRR mode of the activator. How can it be helpful in the, it's Aspergillus, it's again a widespread fungi in the domestic surroundings. How can it be helpful for a normal person? You can use at first this activator to produce the so-called activated water for health purposes, and then you can use this to activate your domestic cleaning agents, which will be much more active and was cleaning in a better way if you use it in the activated stadium. The other field of use is the lowering the use of pesticides in the agriculture. It's only a remark in our lecture, because for agriculture we use other devices. The devices activator and acaton, they are used only for medical and domestic purposes. In industrial agriculture, the amounts of solutions used are much bigger, and you must use other technical devices. But it helps you to increase the activity of pesticides. And we have now a European project, European research project, how to use this activated water in aquaculture to improve the homeostasis of the fish population in aquaculture and to reach higher results. This project is going on up to now with good results. We have, and will be finished at the end of the year. What we have seen now already is the improvement of the immune status of the fish, and we have an increase in mass production of the fish. So the fish is growing bigger in comparison with untreated aquaculture. But for this, in this case, we have oscillators which are nearly, well, let's say, like a tablet computer on this dimensions, and we put it in the aquaculture, and they are from 16 to 24 separate oscillators working in a parallel working process. It's only a short remark for your information. If someone is interested in agricultural use, we must have a separate discussion. What we can find in domestic use and in agricultural use is the improvement of plant growth. That means your the activity of solutions of nutrition agents for plants can be increased. We find a better growth and bigger amount of fruits from even garden or domestic plants. Here's a summary of the general influence. That means you have a better quality and you can stimulate the plant growth. You can shorten the periods of growth of agricultural products, increase the yield of crops and growth of home plants, and the resistance of exotic plants can be increased too. The use of this activator has some of advantages. We have a decrease of poisoning risk. We have an easiness of use, and we have, like all these methods, no ecological or biological side effects. So it's helpful to use this kind of water treatment in different cases. I myself personally use this water permanently, and I think I have a feeling of good influence of this water. So these are the basic information about the use outside the field of medicine of low intensity and extreme high frequency radiation. If you have some questions, please let me know.
I do have one question from the beginning. If you mentioned allergies, it's contraindicated. If someone, for example, has a nut allergy, would it be contraindicated?
It's not contraindicated generally, but to use this point stimulating the immune system, this is contraindicated, because if you have activated the immune system, you have a much stronger expression of autoimmune effects and of allergy effects. So you can use the Akatom in different kinds of diseases, of allergies, for instance, to improve the functions of the lung, of the bronchia, but you must avoid to use this point and activate the immune system. For instance, last week we had a patient which had an inflammation or an infection of herpes zoster. Herpes zoster, I don't know the English word for this. I try to find it. Shingles.
Shingles.
It's an infection with a virus, herpes zoster.
I know what it is.
Yeah, and this is a very painful disease. And we had very good results to influence with the Akatom locally. But this patient had parallel an autoimmune disease, and so we didn't activate the immune system, which we would be normally do in the case of a virus infection. but we didn't do it in this case. We only work locally to this inflammation places, and the results was very good with the red and the yellow oscillator.
Can I just give you some experience I had a week ago?
Yeah.
I had Staphylococcus infection in my thumb, and where I damaged myself. And I think because the body system was down, I got a shingles infection as well. But I used the system. I used the AKTOM locally, and my shingles started, but then it disappeared.
So it's a very good result for you.
Yeah.
And
so
in case of infections, that's why I spoke about this, you can not only use the AKTOM locally, but you can in addition activate this immune system point. Because it has a general influence to the immune system. And as I show you in laboratory conditions, that there's really an effect on Staphylococcus aureus destroying the bacteria with the help of AKTOM.
Okay. So the one question I would like to ask is the bone stimulation, the bone growth stimulation.
Yeah.
I don't know if you covered that in the previous lecture.
We have different kinds of oscillators, and one is the green oscillator, 5.6 centimeters.
Yeah.
And this green oscillator is especially supporting reconstruction and recovery processes of tissues. So if you want to activate or to support bone growth after a broken bone, you can put it to the place and working with program 1. In addition, you can use the yellow or the red oscillator with program 2, because you have normally around the place where the bone is damaged, you have an
trauma.
Yeah. Concentration is down.
Oh, bruising, trauma, yeah.
Yeah, bruise or hematoma.
Yeah.
Hematoma. And especially this program 2 helps you to decrease or to destroy this hematomas. We showed it in a lecture before. And this gives you a support in destroying these hematomas and activating the local blood flow, which gives you an additional support in the healing of bone after a damage.
And that is with the red,
No, you can in program 2 in BRR application, you can use both the yellow or the red. If you have no red, then you can use the yellow one. If you have one, you can use a red one.
Great, thank you. And you just leave it on, do it for 1 minute, then you leave it on for an hour.
Yeah, the minimum time is 30 minutes, 40 minutes. You can leave it longer after, let's say 2 hours. you must redesign or repeat the program 2, because the status of the biological tissue and the status of the wound has changed in this time, so it makes sense after 2 hours to repeat the programming mode 2.
Great, thank you.
These 30-40 minutes, these are not medical limitations. These are practical limitations, but because in the normal treatment and physiotherapy, you have only 30, 40, 45 minutes for one treatment, and so they use the whole time. But if you leave it longer at the place, of course, it gives better results.
Okay, thank you very much.
Okay. Some more questions? In a practical experience, I can say you that this activated water is widely used in my friends, my colleagues, and I know even some of my friends. He is a physician and he is working with homeopathy, and he always activated his homeopathic solutions with the activator.
Would that not change the homeopathic solution? Because it's got information in
it. I'm not very familiar with the theory of homeopathic treatment, but he said me that there is written in information in the liquid, and this information is more active when he treated the solution with this Akatom activator with program 2. That means not program 2. There is only in the activator 2 programs, and one is the BRR program, and he used the BRR program for the treatment of his homeopathic solutions. This BRR has there's some very interesting discussions about the possible information transfer with this BRR mode from one biological object to another. In Tomsk, where in the Tomsk University was done in research, that they tried to write on the crystal, on the oscillator, the information of a bug. The bug is coming from Korea to Siberia and is damaged there a lot of wood, trees, and they wrote down the information of the bug and put it on the tree. And for the other bugs, this tree seemed to be occupied already by bugs, and so they didn't invade to this information transfer tree. It must be now proved, but it would help very much if you have some invaders from outside, from other regions of the earth to biological surroundings in Europe or in Russia, to avoid big damages of the surroundings, of the natural environment.
Thank you. I have no more questions at the moment.
Okay, thank you very much. Yeah, this is all the additional information which I try to give today. I don't know, should we have some other points or should we stop today?
If you've got any information on the larger application of it, I would appreciate that. For example, treating swimming pool water.
Yeah, we have, let's say, so we now tested this aquacultural project. We tested bigger oscillators. I said before, it's the amount of a tablet computer nearly. And if this project is successful, we will give this devices to industrial users or to agricultural users, and this will be viable in next year for a broader public. Now it's only laboratory research.
Thank you very much, Dr. Zenke.
Okay, I thank you.
Thank you, Maria.
Very much, Dr. Zenke. Thank you, Keith, for coming. And if there are no more questions, we can finish. And,
okay.
Hope to see you on Monday on our farewell party.
You can go if there are some questions, you can collect them, and then I can answer them on Monday.
Mm-hmm. Sure. There might be some questions because it's quite late, so somebody couldn't participate live, but for sure there will be some questions.
Okay.
Thank you.
Thank you very much.
Thank you.
Good night.
Bye.
Here's Martin.
Bye.
Bye.